My name is Mandy Russel. I'm a family nurse practitioner here at the Lifespan Adamsville location. I work Monday through Friday from 8 to 5, and I take patients from 6 months up. My name's Valerie Barber. I am a physician assistant here at Lifespan. I've been here for a little over a year now. And my role at Lifespan, I am a primary care provider. So I see children from 6 months up on into our elderly population.
Hi, my name is Amy Roland. I'm a family nurse practitioner. I work here at Lifespan in Adamsville. This is where I was born and raised and have decided to reside with my little boy who's 8 years old. And on a daily basis, we do a lot of different things. Normally, we have to take care of patients that have a lot of chronic conditions, and we make sure that we maintain their medications and do whatever we need to do to improve their quality of life and their overall health.
My name is Irwin, and I work with the finance department, and my title is accounting assistant and payroll, and so my day-to-day responsibilities vary. And so I work directly for the CFO, so in doing what I can to help take things off of her plate and crunching numbers of how many patients we have and we process, and how many numbers that equals out for our providers, which is critical in doing grant work and funding that aspect of it.
My day-to-day function here at Lifespan, I'm a primary care provider. I interact with patients. I try to make connections with them. So I tell my patients, I can't help you if you don't help me help you, okay? So we see patients with high blood pressure. We see patients with high blood sugar levels. So I just talk to them in a personal way, saying, hey, this is where I want your blood sugar to be. This is where I want your blood pressure to be. Communicate with me, help me, like I said, to help you.
I enjoy working with patients and getting to know their backgrounds and their families. I enjoy working with providers that I've known from other aspects of the community, whether it's church or volunteer work. And I enjoy working with Lifespan's resource systems for patients that are uninsured.
I feel like that you need that connection with patients in order to achieve the goal that you need to. And with our community health center, we do have goals that we need to meet. For instance, people who are diagnosed or patients who are diagnosed with high blood pressure, there is a certain blood pressure reading that we need them to make. So we'll give them blood pressure logs to take it home. We try to get the patient to be more active in their own care.
We try to have a good rapport with our patients, so we have an open door type policy. We make sure that they feel welcome, and we try to attend to any kind of need medically they need or socially too. So
I also right now currently am working with Outreach and Enrollment Department, which is what we provide service to the community to help them in acquiring healthcare insurance that they could afford, and that's known as the Affordable Care Act. By others, it's known as Obamacare. And so I've enjoyed that part. That's how I actually started with Lifespan, is I worked with the community and under the umbrella of Lifespan, and we did have a grant at that time. This year we did not receive a grant for that, so instead of being able to hire people outside of Lifespan, they had to use their own employees from within, because the sign-up period deadline was only 45 days as opposed to a longer period last year. And so that has been an eye-opening experience for me, understanding how that actually works, and the benefits that the community receives is huge. And so knowing that we can make a difference and impact the community based on their needs, and then also at the same time providing them the opportunity of just education is huge.
The nonprofit aspect of our healthcare center is something I've always felt passionate about. I come from an ER background where they use the ER as an access point for family or for everyday day-to-day care. Here we have the ability to take care of everyone despite their ability to pay, more or less if they have insurance or not. We have available options that they will qualify for that will make healthcare available to them where it was not previously. So in that regard, we're taking care of those people that have not been able to provide the kind of insurance or the financial portion of the medical need that they can come here to get all that, despite where they're at in their lives, I guess more so.
It's so much easier because I'm not limited on what I can provide the patient. We have the contract with the hospital that makes getting that ultrasound or that x-ray at an affordable cost easier. We have the ability to get the labs covered under what they pay when they come in. So if someone comes in and they need to be worked up for, an infection in their stomach and they need an H. pylori test, or you need to do a gallbladder ultrasound, it's not like you have to say, well, can you afford this?
So I believe with Lifespan being a nonprofit community health center, I believe that we are able to connect more with the patient, that we give more quality care versus pushing people in and out for a profit, because a lot of times your clinics that are there for profit, it's about numbers. It's about getting patients in, getting patients out. And the problem with that is that you don't make that connection with people. They feel like a number. Here at Lifespan, I don't want my patients to feel like a number. I want them to feel like my provider took time to see me. They were not rushed. They care about my health. They want me to do better. That's how I want my patients to feel when I interact with them.
There was actually a situation that happened this morning where a person drove by and he was having trouble breathing. And so he was apparently in such a critical state that he was not currently a patient of ours, but we're not going to refuse care. And that's one of the biggest things that Lifespan touts is we're not going to refuse you based on what your ability is to pay. And so they were able to take care of him and stabilize him until the EMS came. And that's huge, because not all places may be in that situation to do that. And so not being confined gave us that freedom, I think, a little bit more so to not feel like we could not give him the quality care that he needed and deserved.
To be able to come back and serve a community in which that I grew up in is beyond my wildest dreams. It's such an amazing opportunity, and I'm so thankful to have that opportunity. And so my goal is to make the community that I grew up in a better place, more knowledgeable about health, about ways that you can take care of yourself, about preventative medicine, preventing sickness, preventing illness, living the best life and the longest life that you can, and be the best you that you can. So I do that mainly myself, having a nursing background, through education. Educating your patients is the best way that you're going to get them to comply with what you're asking them to do.
Feeling comfortable where you work is an important part. So it's not always how much you make or what your benefits are. It's, do you feel like your quality of life is still good? And so I think that's kind of that's the objective of Lifespan, is providing quality of life for people and how we treat our patients and other aspects of that. And that doesn't fall short of employees too. So I'm thankful for that.
I love working for Lifespan because it's like an extended family. The people that I work with are a team. It's not this person or that person. It's how can we work together to make our community better.